Welcome, everybody. Our guest today is Dr. Kelly McCann. She lectures internationally on mold and mycotoxin illness, chronic infections, and mast cell activation in environmental medicine. She's triple board certified in internal medicine, pediatrics, and integrative medicine, as well as certified in functional medicine. I'm Dr. Keesha Ewers, and this is my daughter, Reagan Claire. And we are thrilled to share this new episode of the Liberating Generations podcast with you.
Thank you so much for having me.
We're so glad to have you.
Meet you. So nice to meet you. Dr. Kelly, your passion for learning is so obvious. To be honest, we didn't even try to list all of your credentials. So we want to start with what happened to you when you finished medical school and your residency. I heard you share that you went through chronic fatigue, fibromyalgia, and terrible depression. Would you be willing to share some of that story and what you think the puzzle pieces were to landing there?
Sure, I'm happy to share that story. So I graduated from residency and I took a job in Oregon at a little town called Corvallis. Maybe it's not so little, and then I was actually working in a smaller town outside of Corvallis. And I didn't know it at the time, but my office was probably moldy. It was Oregon, lots of rain, and it was a flat roof building that was probably, I don't know, 30 years old. And so I just became more and more depressed. I was single. I didn't really have that many friends. It was a small town. And so it was compounded by a variety of different things, being isolated, not having a support system, a very good support system. And I didn't know it, but the mold was probably driving a lot of inflammation in my brain. And so, yeah, fatigue, fibromyalgia, and just terrible depression. And at some point, I knew I had to get out of there. I'd always struggled with a kind of low level depression my entire life, more dysthymia than true depression. But it got really bad when I was there and I stopped sleeping. I would just wander the house, trying to get myself to calm down and sleep, and realized that I probably didn't have any serotonin. Taking 5-HTP definitely helped. And then getting out of there really was one of the things that helped. And yet it was pivotal because it enabled me to have a lot of compassion for people and also explore what the heck happened to me.
Yeah, we live in the Seattle area. We're familiar.
Yes.
Yeah.
Yeah.
Mold is everywhere, of course, but then there's going to be, I look at it as a predisposition to how it impacts us. So if you'll indulge us a little bit, I'd like to pull in a little bit of a quote from another interview you've done where you said, somewhere along the way, I got a master's in spiritual psychology. And that was really a personal game changer because it helped me work through a lot of the misbeliefs that I had about myself and about the world, which I think has really helped me help patients understand themselves a little bit more so they could really get to some of the root cause beliefs that are interfering with their healing. Our show is really all about that, the interference that doesn't necessarily even begin with you, because your exposure to mold, you might have a genetic predisposition to having it upregulate some neurotransmitter SNPs or single nucleotide polymorphisms that predispose you to depression, so there's like so many circumstances or conditions that can create this, right?
Right. Yeah. So, the Master's in Spiritual Psychology program at the University of Santa Monica really was a game changer for me, as I had to face myself in a way that I had never had to do before, even in doing therapy, as a younger person. And there was one time, so the way that the course worked was we did things in trios. So you'd have one person who was the counselor, one person who was the client, and then there was a third person who was like the battery, just kind of holding loving space. And one of the projects that I had was working on my relationship with my dad. And it was more working on my own perception of my relationship with my dad. Because I know my dad loves me, but or at least he tells me that he loves me and he does things that show me that he loves me, but I never felt like he really loved me, you know? And and there was this session that I did in this trio, and I was the client. And the counselor asked me, like, what was the very first time that you felt that your dad didn't love you? And, whether you believe this or not, doesn't matter. It's like for therapeutic reasons, right? So I the flash that came to me was that I was in the womb, in my mom's womb, and I could feel her energy and feel her love for me. And then I like reached out energetically to feel my dad. And what I got from my dad was this, like, you know, he didn't want me. And what I realized was that I had a misperception. I perceived that my dad was rejecting me. My dad was 24 years old. I was his first kid. He was terrified. Of course, he was afraid, right? And so, as an adult, recognizing the circumstances of my perception of that event, I was able to really heal that inside of myself. Now, I think that his rejection of me, what I perceived to be his rejection of me, was not only his fear, but it also set me up for great success, right? Because I had to prove myself. I had to prove that I was okay, that I deserved to be here, that I deserved his love. And so I have a wall of, certificates that show that I am worthy. See, Dad, I'm worthy. But in recognizing the circumstances that were really there, I was able to heal that inside of myself. And now my pursuit and love of learning has nothing to do with making dad love me. It's because that's just kind of who I am. And that's become how I love to be in the world. So it was really, really healing to to acknowledge that and forgive myself for the misunderstanding that he didn't love me.
Mhm. I'd love to take that and track it just a little bit and tease it apart because we have a very similar story, by the way. All my alphabet soup that comes after my name
Yeah.
is definitely about proving my worth in the world to my father,
Yes.
and that's a very common story. And what I'd like to land on is that word perception, because oftentimes I teach for the Institute for Functional Medicine, and I'll say to the room full of doctors, stop telling your patients to get rid of their stress. They have maybe jobs they love, or maybe they have a special needs child, or they're caregiving elderly parents. Like, what are you going to do? Have them throw that all away because that stress is causing them to be ill? That isn't accurate. It's their perception. It's their relationship to it, right? That happens right here. So
Yes.
our adrenals don't fire off as going into fight, flight, freeze, or faint unless we perceive ourselves as somehow in danger or not okay, not good enough, not fast enough, not beautiful enough, not smart enough. And so the fact that you brought in this word perception, I think the first step of healing is the willingness to look at your own perceptions, really
Absolutely.
examine those, right? Because the ones that the child mind came up with fit exactly for that time period.
Hmm.
But when we have them running the show in adulthood, they're often barriers to our well-being, to our health, our happiness, right?
Absolutely. Absolutely.
Mm.
I agree. And I think that that's what allows us to be stuck in victimhood, right?
Yeah.
Because it's the outside world is stressful. The outside world is causing me distress? No. It's our reaction to that. It's our perception of those circumstances.
Mhm.
Yeah.
Yeah, we talk a lot about the victim cycle in our family, how at some point in our life we are the perpetrator, we are the victim, and we are the rescuer. And it's so easy to get caught in that cycle of being victim.
Drama, drama, drama.
Drama. Yeah. I mean, I think it's actually, in a way, a form of an addiction is putting yourself as the victim in situations. And it's kind of like this power dynamic in a way. And so I'm
Mhm.
curious, can you talk about how much the identity of victim becomes a part of our health story?
Yes, it does. And we don't even really realize it. And I think some of it is because, like, the way that most people see the world is outside impacting us, right? We don't we don't learn in our families usually that it's our perception and it's our perception of those things. So one of the tricks that uh, I learned at the University of Santa Monica is anytime I find myself saying, I'm upset because,
Mhm.
that's a clue to me that I'm going into victimhood, right? I'm upset because of something else that's happened. I'm upset because of what stuff I have going on inside of myself that may or may not accurately reflect what's going on in the world. And um, we can't take personal responsibility for our perceptions and our beliefs if we're stuck in victimhood.
Mhm. Well, and that's the powerful part of it, right?
Yes.
And
Yes.
oftentimes in medicine, we call that the secondary gain of illness. It's like, okay, so if you have a chronic health issue and like an autoimmune illness or chronic migraines or menstrual cramps that happen every month that take you out of, of flow, right? Is that is there a secondary gain to that? Is that your body pulling the plug on a way that you've established from a very early time that I have to be overscheduled, busy, busy, busy in order to feel good about even occupying a space on the planet,
Mhm.
and then the body says, okay, no, to bed. Right. And so the secondary gain can also be, it was the only time you got attention from a parent who was also very busy and programmed in the same way where productivity and achievement were the orientation.
Right.
So, I think the victim space is a very powerful one because then we don't have to take responsibility for our
Exactly.
perceptual field, right?
Right.
Yeah, the trigger of I'm upset because I also have another one that I look for, and that is I would never do that. Right? Anytime we get into that one, oh,
Oh, yeah.
be careful, right?
Right, right. I'm
Do that.
projecting.
I know, exactly. Exactly.
Yeah.
That person's bad or right. And so, really disowning or projecting some part of ourselves that we're upset with onto another circumstance or another being or, organization. So I think these patterns, which is really what we're talking about, patterns of perceiving in Buddhism, there's a whole volume of text which is so amazing called the Abhidharma. And, they talk about perception having 17 different steps. Like,
Mm.
like if I look at your painting behind you and say, oh, those are poppies and they're red, I just went through 17 steps of information that was coming in through my eye mind. They talk about 6 minds, that we don't just have one mind, that we're
Mhm.
getting information through our sensory organs. And then the mind that we consider mind is synthesizing it all. And we're creating an opinion, about that's based on patterning that we've had set up forever. And that will continue to do it the same way forever if we don't interrupt the pattern. And that's what I love that because when I learned it was 17 different steps, I thought, oh my gosh, like who counts this stuff? It's amazing. Well, thank you for that gift, everyone. And
Yes.
they have like this midpoint in that 17 steps that they call the doorway to karma or the gateway to karma. And it's like you talked about response. You get this ability to have the stimulus that you've always responded or reacted to, and you make a gap
Yeah.
in that gateway, right? And then in there, you can use your adult mind. You can use your advancing stage of development and in your evolution of growth and life and planet Earth to then question, like, is the way I'm perceiving this right?
Yeah. Is it
Less
accurate?
supportive, or or is it more suffering, involved here? And is there a way that I can go from reaction, which is instant, to a response that brings the wisdom of life that I've lived to this gap? And I love that. And the patterning, that we're talking about of how we perceive and how we react versus respond, that's set up in generations. It's nurture and nature, right? We have
Right.
genetics, but then we also have the things we've observed and the people that have brought us into the world and how they respond or versus react. It's probably because of the way that they observed and so on
Mhm.
and so on and so on. And I love this idea that you'll always do it the same way, which means the next generations will continue to do it the same way unless there's a pattern interrupt.
Right.
And so when we talk about generational trauma and this idea of being a victim, how does this what does this have to do with our health story?
Well, yeah, I think that if we perceive that things are happening to us and that we don't have the autonomy, um no, I mean, it gets a little tricky. But okay, so I have, like, say somebody has an autoimmune condition, right? And so that happened to me.
Mhm.
And as long as you have that filter of it's happening to me, then there's no room for changing that pattern. So, but it may
Mom
be
had the same one,
right,
right?
right, right.
Yeah.
So that's the same reaction that is perpetuating. So, yes, there's a genetic predisposition to having an autoimmune condition, but like, for example, my mom has celiac disease. And I, in my 23andMe, it said, well, every risk factor is an autoimmune condition, but I don't have an autoimmune condition. I don't have one. Um, because perhaps I decided to break that mold
Mhm.
that I'm a victim. My mom had issues with her dad. He was a physician and he left the family, and she never got to do whatever she wanted to do to heal that relationship. And I think she's still angry at him.
Yeah.
So, um, whereas with my dad, I was like, okay, I got to take the bull by the horns and I need to work on this relationship
Mhm.
and work on my perception of that relationship and try and make that something else. Um, Now, obviously, when you have stuff like fatigue and depression and things like that, there's still some stuff to work through, but that's just an indication that I've got work to do. And so that could be an indication for patients. Hey, I've got stuff. I've got labels. I've maybe maybe I need to look at my perceptions about things.
Mhm.
And I do find that many people will have this "I'm not worthy" um, belief system, and that tends to lead to certain kinds of conditions. And then there's the overachievers that, have these other conditions. Um, and then they can be the same conditions, but it's the misbelief that is really driving a lot of that.
Mm. Absolutely. And, I think in our society, we're kind of taught that certain emotions are bad. There's a judgment placed on certain feelings. One of them being anger. I think a lot in our culture, we're taught that we're not allowed to express anger, especially women.
Mhm.
And because of that, oftentimes the expression of anger comes out sideways. It comes out in explosive ways. And in Ayurvedic medicine, they say, it said that autoimmunity is actually just undigested anger. So, what would you say to our listeners here about kind of undigested anger?
You talked about your mom with
Yeah.
celiac, which it's just so like, woo!
Anger with her father for leaving.
Yeah.
So,
Oh,
you're saying
absolutely.
the healing that you've done, the healing that you've done with that generational break of with your dad, that's you've processed. You've actually let those emotions come to the surface and actually processed it through. And so then it's not exhibiting as an autoimmune disorder. So
Right.
yeah, I'm very curious what you would say to our listeners.
So I see the body as speaking in metaphors. And so it offers us the opportunity to really pay attention because our bodies are talking to us, they're giving us messages. And if we're willing to listen and do some introspection, then we can figure out what the heck the body's trying to say. So, I remember having a patient who had Hashimoto's and hypothyroidism, which a lot of people have, right? And
A lot
what's
of women,
a
especially.
lot of women, especially.
Yeah.
I know you asked about undigested anger, and I'll get back to that one. But um, what's this area of the body, right? It's right here between your head and your heart.
Mhm.
Mhm.
Are you not speaking your truth? Are
Mhm.
you not living in alignment with your head and your heart? And if so, how are you not living and speaking your truth? And is there a way that you can start to do that, start to look at that and heal that thyroid um, energetically, which may eventually turn into healing it on a biochemical level. Who knows? But the undigested anger, I mean, that's inflammatory bowel disease, that's celiac disease, that's all of that. And even irritable bowel symptoms. I mean, we know that the solar plexus, the chakra, that chakra, that's our connection to the world and connection to other people in our lives, right? So if we don't feel connected or we are upset with what's coming in to our bodies, we don't want to digest the experiences that we're having, it's going to come up in other ways. So
Mhm.
I think that there's plenty of metaphors there that people can play around with and start to really listen to what their bodies are trying to tell them.
Yeah, it feels to me like in Ayurvedic medicine, they talk about the body being the canvas of the mind, right? But when the body is imbalanced in one way or another, all the things that we've just listed and many more, that it's trying to get our attention, kind of like a toddler pulling on mom's skirt, saying, "Hey, hey, hey,"
Mhm.
And do we turn toward the body and know it has wisdom, or are we giant brains trying to drag the body behind and,
Mhm.
in a tyrannical way, say, I expect you to do this, and
Mhm.
there's no parent-child relationship that comes out good with that kind of stewardship. So
Right.
it's a really beautiful way, I think, of looking at the body is to say, okay, it's got this beautiful wisdom. It's trying to speak to you. It's not got a linear language pattern. It's just got ways that
Mhm.
it has to tell you something, right?
Right.
Yeah.
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 I had an experience with a patient who had migraines, and he came in one day and he was in a full blown migraine, and so I turned down the lights and was like, okay, let's see if he's willing to go there with me. And so I actually did a gestalt, had him do a gestalt where I set up two chairs and I was like, okay, in one chair, you're adult you, and in the other chair, you're your migraine. And we're going to explore and have a conversation and, figure out what your migraine is trying to tell you.
Mhm.
Um, if you don't want to set up chairs and do this way, you can, like write with your alternate hand, your other hand, but and have a dialogue that way. But what he did was go back and forth and listen to what his migraine had to say, and it was so profound. I think this was quite some time ago now, but I think he, realized he was angry about his father and had a difficult relationship with his father. Poor dads are really getting the shaft today.
I feel like moms get it a lot too. So I mean, we're not first kid.
Everybody gets it, right?
Everyone gets it. Yeah. Blame and
Mm,
shame to go around everyone if we're in that
exactly.
space, right?
Right. But, he processed through that in this gestalt, in this dark exam room and, with his doctor. And it was so beautiful to witness him just like recognizing it and then recognizing that he didn't have to hold that anymore, that he could let it go, that he could forgive his dad, forgive himself. And it was so beautiful to witness. And I don't even think that the migraines ever really came back after that. So it was just super profound.
Mm.
Mhm. Love that. Yeah. I think that it's oftentimes we have such a hard time sitting with pain, sitting with discomfort, where there's such an aversion to that. And so that's so beautiful that he was able to, sit in that migraine and actually listen to what it was trying to say. And I think that that's, an incorporation of a beautiful spiritual practice within your practice. And I'm curious, do you have any other, simple tools or practices that you would share with our listeners that they can do on their own?
Well, I mean, they can set up the chair too. So it's something that they could do. If you're having if because I think that moving back and forth between chairs, as silly as it sounds, if you we can shift our consciousness. We can have a dialogue with another aspect of ourselves and really learn from that other aspect if we're willing to suspend disbelief, right? We think that we're this integrated being, but we're really not. We have our child self, we have our adult self, we've got our bad girl self, we've got our good girl self, we've got the self that we portray to the world. And then we got the self that we, share with our family, which is usually not very nice sometimes. So the truth is we have multiple faces and we can tap into those aspects of ourselves and really listen to what those aspects have to tell us, listen to those parts of our bodies, listen to those aspects that we wanna shove away,
Mhm.
right?
Mm.
Right?
Yeah.
And if you don't wanna move back and forth between 2 chairs, like I said, you can, write. So you have to get out a pen and paper. You can't do this on the computer, and you write in your dominant hand as your adult self who has the wisdom and the perception, and then you write in your non-dominant hand as that aspect of yourself. And of course, usually when you're writing with your non-dominant hand, what time frame are you accessing in your life history? You're accessing that child, like 3, 4, 5, when you're learning how to write.
That's what my
You're-
writing looks like. Yeah.
Mhm.
About two. Oh, it's my non-dominant hand.
Oh yeah. Oh yeah. But you
Yeah.
can access that aspect of yourself, right? All those
Yes.
struggles of feeling inadequate, like I can't make these letters look right.
Yeah.
It's a great way to tap into that part of yourself and to those beliefs that you are starting to hold in the world. And you might be really um fascinated with what you learn there about yourself.
Well, what you're pointing to is, we talk about in Western science and the way that we conduct double-blind, randomly controlled studies, the interrelator piece of that, where oftentimes it just takes somebody listening to someone's story and then they get better. It's not really, that's why we have a placebo effect, right? It's
Mhm.
not really about the pill, it's about the attention
Right.
and being listened to, right? And, there's an ancient Buddhist practice too that's called feeding your demons, which sounds terrible, but it's the in that way of thinking. It's not Judeo-Christian imagery. It's really like thinking about shadow aspects that will come forward. And what is it that one wants from you? What is this fear trying to ask from you? And, or what is this anxiety, and when you have panic that threatens to overwhelm you, what is this part asking from you? And, we, again, with that achievement oriented productivity, don't slow me down, just do it. We got to get through this. No pain, no gain. And just slowing down to really turn and say, oh, welcome, welcome. I see you.
Right.
And the answer of what it wants is always the same, right? Love. Acceptance.
Yes. Oh,
Recognition, it's like,
right.
yeah. So, I mean, that's always what the request is. And so that exercise you just described, falls in that same space of, getting up and down from chairs may feel awkward and clunky, and Gestalt therapy was very successful because it actually has a somatic aspect to it. Right.
Right.
You can get up and you can actually curl up as fear, or be huge like pain, or, you just can feel inside like what that experience has been for you. And then,
Right.
yeah.
Yeah. I mean, I think that this is what is sometimes lost in talk therapy, right? You go to the
Yes.
therapist and you talk about stuff and you're all here.
Adult brain.
Adult brain.
Yes.
You're never gonna
It doesn't
resolve the
work.
issues. No, it does not work.
It does not work. Thank you.
It is the experience of that emotion. And even, saying, hey, well, all this aspect wants is love. And like, okay, I get that here. But you have to feel it. You have to experience that emotion. You have to experience the fear. You have to experience the upset or whatever it is, the disappointment, the hurt, the anguish. You have to feel that feeling. And then once you feel it, you can start to move through it. And I do think that a big piece of this is not only the perception, but the forgiveness, right? Because we often hold grudges against ourselves. We hold grudges against other people. And unless we allow that forgiveness, which is love, in, it doesn't shift.
Yeah, that's I gave myself a spanking case of breast cancer from not forgiving myself for what an earlier version of myself, had allowed to occur. And, my son came to me when he was 18 and said that he and his brother had been sexually abused by a boy in the neighborhood. And, like that happened on my watch. I instantly as a mother, check that. Oh, and so went through this whole process with them, got him into therapy, found the now young man, and had dialogue between. It was just amazing. It facilitated this incredible forgiveness process. Eventually, it was so beautiful. And then 4 months later, I was diagnosed with breast cancer. Well, guess who had been left out of that entire process?
You. Yeah.
Yeah. I was going back and quite abusively, with the vision and the wisdom of the age that I was at that point, judging the one earlier for not protecting your children, with 20/20 hindsight. And boy, was that ever the hardest thing. The hardest thing I've ever had to do is to forgive that one, right? That stage of that motherhood right there. And she was a baby on my hips. And I can remember opening the sliding glass door and yelling down. They were all jumping on the trampoline saying, hey, do you want to just stay while I go to the grocery store with the baby and I'll pay you to babysit it? And I would just see her, and just go, protect your children, don't do that, and I couldn't forgive her. So as soon as that ultrasound wand went over my breast tissue and there was this tumor with this blood supply that was just so strong, right over my heart. I went, I know what that is. It was self-loathing.
Right.
It was self-loathing in form with a
Wow.
blood supply that was just feeding it with my own hatred for that,
Right.
and I went, okay, I know what I have to do. I,
Right.
helped everyone else in this situation. And, in a month, that thing was gone.
Wow.
That was gone in a month. And it was because right there, it spoke, like I could see it on the screen. It was just speaking to me like, yeah, this is your creation.
Yeah.
You're doing this right now actively. And so it was so powerful, like the power of the mind. And that comes from generations of perfectionism. My mom and dad are real good at perfectionism. And so, and my kids struggle with it. Like it's just I always say recovering perfectionism, right? It's one of the patterns in our family. And
Right.
so it was just such a great teacher. It was an amazing teacher. So it's really, and I said this in another podcast episode, it's a form of abuse to go back and judge an earlier stage of life that is you for something that they did, that they didn't have the wisdom that you have today.
Right.
Not
If
okay.
if you had known better, you would have done better.
Exactly. So, and then taking that to, the ones that raised you, right? And giving your child part a voice to be angry, and like letting all parts speak. And then at the end, I think sometimes people rush to forgiveness,
Oh
right?
yeah.
It's sort of
You
like
can't do that.
pulpit forgiveness, where it's in my doctoral research, I did this study called the Healing Unresolved Trauma Study, and forgiveness is one of the interventions. It was really powerful, but only in the right space, only in the right spot of the process. Like that you can't spiritually bypass.
No, you
You
can't.
have to feel all the feelings.
You got to feel all the feels.
You have to go through all the anger, all the shame, the
Digest
hurt,
it
the dread.
all.
Yes, exactly.
Yeah. So it's
Yeah.
easy. It's easy to say, "Oh, I just have to forgive myself. I have to forgive those past versions of myself for not knowing any better, for doing the best I could at that time." But what are the steps that you took in your healing? Like what did you go to therapy? What was it that you did personally?
Yeah. Yeah, it's a great question, because that's always the follow-up question is, so how do you digest this
Right.
stuff, right?
Yeah.
And so for me, I had reversed an autoimmune disease 10 years prior to that. And so I was already in this, like being able to track, oh, I know where that came from. I need to go straight into trauma therapy, and talk therapy doesn't work. And so both of us have been trained as heart-centered clinical hypnotherapists, and with 2-year internships. So I went back into that community and said, all right, I'm showing up. I got to do this, And I remember in the process of one of the sessions where I was clearing this, I had these teddy bears. I have 4 children, and I had all 4 of them as teddy bears in my arms, and I was just sobbing. I'm so sorry. I didn't take care of you. I didn't protect you. Just sobbing. And as the session was finishing, the therapist who was guiding me, when I opened my eyes, she had tears running down her face, and she said, "If only my mother gave even an ounce of shit that you give right now for this. Like, I wish like that every child could have a parent that had so much remorse, and regret for that moment in time. It's not like and she talked about her own experience, and just how I think that just to answer this question, part of it, and we landed on this in another podcast episode, is also being in community with us, right? We're so isolated, and we go to therapy, which is exactly what I did, but I had a community there.
Right.
And the therapist that I was working with was someone I worked with before. We went to school together. And so she could actually show up with her pain in Rupert Sheldrake's morphogenetic field, right? Where here, like, here's the spot energetically where we are, and we could move it together to something quite larger in the vision and say, yeah, this happens. And what's important is the remorse first and regret for whatever's happened, and then a repair, right? And being able to then get to forgiveness. So what needs to be repaired there? So, and then not just staying in the wallowing of guilt, which comes with shame, right? Yeah. And just makes everything much worse. And so it was really a beautiful process because it wasn't as sort of, I go to EMDR, which I mean, I do EMDR and brain spotting, and I definitely could have taken this to that. But this felt so powerful, and it was joining with other people who were mothers and children at some point, of course, and then saying, "Oh, look at how that repairs me to see another mother," right? I do a lot of group therapy with medicine and plant medicine, and I find this is the thing that is so powerful about it is everybody dropping into a field of shared humanity that oftentimes we don't get when we sit with our story as if we are the only one, right?
Yeah. I mean, that's one of the reasons why I found the University of Santa Monica so powerful. Because there's, 200 plus people in this room all working on themselves.
Yes. Yeah, with the same agreed upon motivation, which is growth, right?
Right.
Not just to talk about something terrible that happened to them, but to find the way into a new developmental stage. Yeah.
Exactly. It's kind of funny though, because, I remember when I was first doing this, going to school, it was like a weekend, one weekend a month. And it was very, very intense. 4 or 5 hours on Friday night, from 9 in the morning on Saturday until 10 at night. And then Sunday, 9 to 7, something like that. It was crazy. It was very, very intense. And I went to Starbucks to pick up my Starbucks on my way there. And the guy was like, "Oh, what are you going to do today?" I was like, I'm going to go get tortured." He was like, "What?" And, so he, it's very difficult to be vulnerable, right? And in fact, it was torture for me initially to be vulnerable, to have to say, "Oh, I'm flawed. I am flawed. I do all this stuff and I got all these degrees and damn, darn it, I'm flawed."
Yeah.
And I have to tell you that I'm flawed. Oh, that's tough, right? But that's what enables intimacy to happen. Yeah, it's that vulnerability. And that
I would
was such
say as a parent too, this is so important because when I was going through my training, doing the same thing, it was the same exact schedule. We would do these weekend intensives and we would work on all of our stuff, right? And then come home, and during the rest of the month, I would share, kind of like when you're in 5th grade and they say share your work about math, like you show your work. I would show my work to my kids at the dinner table. I would say, "Oh my gosh," I remember calling my mom and saying, when I went through Enneagram training for a couple of years too, and saying, "Oh my gosh, I had no idea. I was such a perfectionist." And she just laughed and laughed and laughed and laughed. And I let her laugh and laugh and laugh and laugh. And then when she was done, I said, "So you found that amusing?" She said, "Well, you're the only one that doesn't know that." And I said, Mom, the apple doesn't fall too far." I'm not sure. And she was quiet. And I said, "Yeah, so," And so we would have these great dinner table conversations as I would share my work. And I mean, I can't even, if there are parents listening to this, I think it's the most powerful thing. Is that right?
Oh, absolutely.
Oh my gosh, that a parent can do is show their flaws. She just was telling me yesterday, like when I found out this and this and this, it humanized you, right?
I had put you on this pedestal my entire life. You weren't human. You were just something that I aspired to live up to one day. And that's a lot of pressure to put on yourself as a child trying to live up to your parents. And so, yeah, when you started being just extremely vulnerable and shared all of the things that you've gone through that make you you. Things that aren't very pretty, things that, yeah, it's life, right?
That's life. It
It's
is not
life.
pretty.
It's not
Mhm.
Not
pretty. It's
pretty.
really, really hard. And yeah, it absolutely humanized you, and it made me start to see life in more of a realistic way, right? Start to see my life in more of a realistic way. It took some pressure off, and it also invited some more honesty for me to share with you.
Yeah.
Yeah.
Yeah, that's really beautiful. You're
I was
very
trying to
lucky.
spin magic in their lives because I felt like if I just made it a magical life, it would be like, the Lois Lowry book, The Giver. They'd have memories to draw from when life got challenging. But instead it was hampering them, like,
Right.
Yeah.
right?
Going out into the real world was real hard.
Right, right. Because
Right.
mom's perfect and
Uh-huh.
I'm not. And how do I do that? Right.
Yeah. Yeah. Life here is perfect. Wait, but the outside world, everyone's not fun and happy and nice. What? Not everyone likes me out in the real world. Yeah. Learning how to deal with that was, phew, I mean, I'm still working on that, not still. Yeah, it's a work in progress, but having the vocabulary to talk about it, being able to discuss it with people who are going through the same thing. It's back to that community aspect of you're not alone. Other people are struggling. You're struggling. And so coming together in community to kind of share in that, it's a powerful thing.
It is a powerful thing. Yeah, you're very fortunate. Um, I mean, I remember being so disappointed when I learned that my parents were fallible. Like, oh God, I thought they were infallible and I thought they knew everything and
Mhm.
they don't.
Mhm.
They're flawed and that was very disappointing. It's almost it's a different experience than what you experienced. And that it has its own like issues with it.
Mhm.
There's this Chinese parable. If you want to know where you're going, ask the people that have been there and on their way back.
Mhm.
And I feel like this is one of those moments with you, Dr. Kelly, is, like we're talking to you because you've been there and you're on your way back. Is there anything that you want to leave our audience with in relationship to what we've been talking? We've done some really beautiful deepening work here, and I'm so appreciative of you joining us in this
Yes.
conversation.
Yeah. Thank you.
You're welcome. Yeah, this has been wonderful. Um, I think I think what I would encourage people to do is to like be willing, be willing to go there, be curious, um, take some time, especially if you're dealing with chronic illness. Um, start to contemplate meaning and significance of what your body might be trying to tell you. Um, and that's a place to start, right? I think that's a reasonable place to start is to say, okay, what is my, what is this symptom trying to tell me? What is it trying to get me to think about, to pay attention to? That's a great place to start. And then explore more tools. So Dr. Keesha, you have so many tools to share. And I'm sure that each person will find the tool that resonates them for the issue that they're going through. Because I think that it's really about learning to listen to your own intuition, your own body's wisdom, your own being's wisdom. Um, and it starts with that listening and that curiosity to hear what your body has to say.
Mm.
Thank you for that. That's beautiful. I know that you're giving our audience a beautiful gift, your introduction to guided imagery and hypnotherapy education bundle. So we'll make sure we put that in the show notes along with your website.
Great. Thank you.
We're really grateful for you and for
Yes.
the time you spent with us today.
Yes. Thank you so much.
Thank you for having me.
All right, everybody. Until next time, be well.